On July 1, Alberta Health will be handing clinical oversight of respiratory service to the AHS Super Board, who will put the contracts to tender. This is the same board that in 2009 tendered contracts for cataract surgeries, resulting in ballooning wait times and worse outcomes for Albertans. Even the Respiratory Home Care Association of Alberta has stated this move will lead to significant cost increases and reduced patient access. Does the minister understand that by not listening to those who are actually providing the oxygen service to Albertans, that this will cause patient harm?
Mr. Speaker, this change will not cause patient harm. What it will do is enable Alberta Health Services to deliver respiratory services to a growing number of Albertans across the province who need these services, Mr. Speaker. My understanding from my department is there was consultation with all of the stakeholders involved. The changes were publicized well in advance, and when they come into effect, they will improve access for Albertans.
I have here a document actually from the Respiratory Home Care Association of Alberta where they specifically lay out exactly what the implications are to patients are. They also go on to say that this move will increase ER visits, increase death rates, increase hospital admissions, increase ICU admissions, and given that sole sourcing of contracts leads to supply shortages, doesn't the minister understand that AHS bureaucracy does not need another opportunity to screw up something that is already working?
Honourable Minister. Well, Mr. Speaker, as the honourable member probably knows, there are multiple vendors across the province, some large ones, but many small vendors who have been involved in the delivery of respiratory services over the years. Mr. Speaker, one of the opportunities in having one health authority to serve the entire province is to achieve better efficiency and savings in matters related to procurement. Mr. Speaker, this is one such example. I said that people were consulted. I didn't say that everyone would agree, Mr. Speaker. Vendors are affected by this change, but our concern, of course, is with access for patients.
Honourable member.
Given that in rural Alberta, some oxygen is already being told that they might not get access, including my own father, and given that this government's very own report from Keith Taylor and Associate says that this type of tender process should be avoided and that the government should keep the current program in place, will the health minister please stop ignoring your own reports and please reconsider this decision and go back to the table and talk to the Home Care Association of Alberta?
Well, Mr. Speaker, in making decisions of this nature, it's very important to separate business interests from the interests of patients. And, Mr. Speaker, the honourable member may disagree with the decision, and she may know people who disagree with the decision, but Albertans expect us, Mr. Speaker, as a province and within our health system, to achieve the best possible cost efficiency and value that we can. Mr. Speaker, there are growing numbers of Albertans who require respiratory therapy as a result of the growing incidence of chronic disease and other factors. We must make provision to meet their needs, Mr. Speaker, and this initiative will do just that.
The honourable member for Edmonton Southwest.